Hi there, my name's Nicole and I'm a student pharmacist. Is there anything I can help you with today?
Yeah, I was wondering if it's okay for me to take this aspirin.
Aspirin. You see it everywhere, and you might even use it. How does it work? What does it do? We're about to find out.
Janine the Science Queen. Queen, 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 queen. Janine the Science Queen.
Science rules.
Janine the Science Queen.
Aspirin is a common over-the-counter medication. It's used for pain, fever, inflammation, and blocks platelet aggregation. You might have heard aspirin being used for heart health. Aspirin falls into the class of non-steroidal anti-inflammatory drugs, or NSAIDs. Let me get one of my experts to show you how it works.
Thanks, Janine. All right. Feelings from inflammation, fever, and pain come from the production of prostaglandins, which is a product of arachidonic acid. So there are two main pathways to produce prostaglandins. One, COX-1, and the second is COX-2. So COX-1 affects 4 different things. 1, your blood vessels, your stomach, kidneys, and also platelets. Platelets are molecules that help your blood cells clot together. On the other hand, COX-2 produces inflammation through cytokines and inflammatory markers. So aspirin works by irreversibly blocking both of these pathways.
Thanks, Angela. So blocking the COX-1 pathway prevents platelet aggregation? And blocking the COX-2 pathway reduces inflammation and relieves pain and fever? Interesting.
So how do I know when to use aspirin? When do I use it for fever and when do I use it for blood clotting?
So while aspirin is taken for fever and pain relief, it's also taken for cardioprotective benefits. A lot of people that take aspirin are at risk for coronary heart disease, stroke, or peripheral arterial disease. Aspirin can be used to prevent future thromboembolic events such as a recurrent heart attack or stroke, and it increases your chances of survival in the future.
Sounds good. So now we know how aspirin works and what it's used for. Let's check back in with our pharmacy intern.
Are you experiencing any symptoms?
Well, my doctor told me it'd be good for heart health. I don't have a fever and I'm not experiencing any pain.
But not everyone should take aspirin for their cardiovascular health. We'll review the new guidelines after this commercial break.
Every year, 790,000 Americans will have a heart attack. Among them, 210,000 will have already experienced their first heart attack. Low-dose aspirin is proven to reduce the risk of recurrent heart attack and stroke when taken once daily. In the event of a heart attack, chewing a non-enteric-coated 325 mg aspirin improves the rate of survival in both initial and recurrent heart attack victims. So, save a heart and buy a bottle of aspirin today.
Aspirin is not appropriate for everyone, so be sure to talk to your doctor before starting an aspirin regimen. For more statistics regarding cardiovascular disease, please visit the Center of Disease Control and Prevention website at www.cdc.gov.
Recently, the ACC released new guidelines to ensure a safe and effective use of aspirin. Let's find out what they are.
Hey Janine, the new aspirin guidelines state that aspirin should be avoided in patients who are greater than 7 years old, a history of a GI bleed, peptic ulcer disease, low platelet counts, impaired coagulation, chronic kidney disease, pregnancy, and concurrent use of NSAIDs, steroids, and anticoagulants.
But why is it so important to check for these in older patients? Does that mean that every person with these conditions should stop taking their aspirin?
Taking aspirin is beneficial in some cases, but for some patients, the risk outweighs the benefits. This is why aspirin is no longer the first line of therapy. It can often lead to GI side effects, including bleeding, peptic ulceration, anemia, hepatitis, nephritis, and hypersensitivity reactions to angioedema, bronchospasms, and anaphylaxis.
Can you tell me a little bit more about your medical history? What medications are you taking?
I'm 45 years old. I have a history of type 2 diabetes, high cholesterol, high blood pressure. For my diabetes, I'm taking metformin 500 milligram tablet once a day. I also had a heart attack a year ago. And after that, my doctor prescribed me a bunch of different medications. I'm on atorvastatin 40 milligrams, lisinopril 15 milligrams, metoprolol 25 milligrams, and also clopidogrel 75 milligrams, so a bunch of different medications to keep track of.
It looks like aspirin will really benefit you. Take one 81 milligram tablet by mouth daily.
Great job, guys. Let's review what we've learned.
We learned that aspirin irreversibly blocks the COX-1 and COX-2 pathways. This ultimately decreases platelet aggregation and inflammation. Aspirin also isn't just used for pain and fever, it can also be used for heart health. Thanks, Queen. You saved my life.
Any day.
Janine the Science Queen.